Okay, so today I'm going to teach you about how the Americans do healthcare. Most people don't really think about how healthcare is done in America per se. They know you got to go to the doctor, you got to spend a lot of money. They kind of don't feel encouraged to seek medical professional help when they need it because it's just too expensive. So what I'm teaching you here is about prevention. So you don't have to go to the doctor, and you can kind of just stay away from spending too much money by doing little things on your own. So my my title is Prevention Over Treatment, and what we're going to talk about is why you're constantly in pain. So, first slide, it's pretty common questions concerning health and fitness. I like to ask, how many people do you know that exercise daily? Like, would you say maybe 2 or 3 of your friends? Or would you say you have a whole group of people that exercise together? If the answer is you don't have anyone, chances are they're not preventing damage to their health. They are going to seek treatment for whatever issues they have rather than preventing the injury or disease itself. Same thing goes here for eating healthy. If you have a group of friends who eat healthy, chances are they're not going to get as sick. And then the last one is, how many people do you know that get enough sleep? As a college student, probably not many. Being a student athlete or being someone who works or is in a lot of extracurricular activities, this is one of the big ones for college students. Sleeping 8 hours a day is very important for your overall health, because if you don't get enough sleep, it can actually weaken your immune system and cause your muscles to not repair themselves. So whenever your muscles don't repair themselves, you can lead to more injuries. So a lot of people don't really understand or realize that, but that's one of the main things that causes injury in people who don't exercise. Now we're going to talk about treatment. Well, what is treatment? Well, when you go to the doctor, they might prescribe you medication, or let's say you break a bone, they're going to have you do surgery. A lot of people don't really like to spend money going to the doctor, so they're going to put off treatment for as long as they can. Like I said here, many people avoid the doctor like it's COVID-19. Who wants COVID? Nobody. Nobody wants to get sick. That's not fun. So they're going to avoid the doctor just like they avoid getting sick. But by trying to avoid being sick, or the idea of being sick, they actually get to a point where their sickness or their injury cannot be fixed. So sometimes it's because of cost, or maybe just like anxiety, or it can be a whole slew of issues, but not going to the doctor to get the treatment that you need can lead to lifelong injury or disease. So let's talk about prevention. What is prevention? Well, prevention is simply stopping something before it happens. When it comes to health, prevention is exercising or eating properly, or focusing on the little things that can assist you with your health. So like whether it's stretching in the morning, or going for a run, or just making sure that you're eating enough and enough of the right things, that's something that health can help. So why is it important? Well, like I said earlier, spending money on doctors is one of the worst feelings, because you have to go to the doctor if you are sick. Like if it is serious enough for you to miss something that you want to do, you have to go to the doctor. And spending money at the doctor is not something that anybody really wants to do. So the next thing that I said here is you want to live pain-free. You want to be able to live your life. You want to be able to be happy and just do what you want to do. Whenever you're not preventing injury or illness, it's very likely that you aren't always able to do what you want to do just based off of whatever illness or injury you might have. So whether that's going for a walk with your friend, or maybe, I don't know, going to a party or something. If you have a pulled hamstring because you weren't stretching and you decided that you wanted to walk your dog and he stepped in a certain way or something, I mean, it can happen to anybody, but having really tight muscles due to sedentary life can be an issue that can cause a lot of pain and allow you to, keep you from doing the thing that you really want to do. So, what's up?
You said a word and I didn't know what it meant.
Okay.
Sedentary?
Sedentary?
Yeah, what is that?
Okay. So sedentary basically just means that you're not moving.
No.
So you're sitting still. So whenever you think sedentary, you're gonna think someone who works in an office, someone who sits on the couch all day. Maybe somebody who plays a lot of video games, somebody who doesn't get out of the house and exercise. A lot of people nowadays are sedentary, and that's actually leading up to a couple of the other things that I have in this PowerPoint. That's actually a really good question, because a lot of these issues that I'm talking about have to do with being sedentary in your life. Okay. So here's the last point that I have here is, how do we prevent injury and illness? Well, a lot of it can be just brought down to nutrition and exercise. Obviously, if you have specific issues, you'll have to cater your lifestyle to those issues. Like if you know that you have a bad foot and you still want to get exercise, well, maybe running isn't the best idea. Maybe you should try something that's not weight bearing, like biking or swimming. So I mean, there are ways to get around every issue, but you have to want to get around the issue. And then obviously for nutrition, everybody knows eating healthy is important, but here in America, that doesn't really happen either. You know, you go down the street, you go to Taco Bell, you go down the street, there's Popeyes. What you have at the home? You can make a sandwich, okay, who wants a sandwich? Nah, Popeyes is good. Of course you're gonna wanna eat Popeyes. But, as they say, an apple a day does keep the doctor away. So that's an easy expression that can explain the nutritional side of prevention. So here I have just a list of common injuries: rolled ankles, cuts and scrapes, broken bones, and pulled muscles. These can happen in a wide variety of things, whether it's falling or just stepping off the sidewalk wrong, or maybe you went for a run and you weren't properly warmed up and you pulled your hamstring. Well, as you can see here in this picture, this guy's foot is huge. This is what happens whenever you roll your ankle. Now, a lot of the time, some things like this can't be avoided. Even the most trained athletes will have injuries. Even the people who work on their body the most will have injuries. But sometimes stuff like this can be prevented a little bit. And we'll get to that in a little while. But the same thing here, you can see on this picture, there's a little line here. This is where he kind of tore his calf muscle. Again, can't always prevent every injury or illness, but there are ways that you can help prevent them. So here is a list of treatment options for those injuries. Generally, it is good to prevent these issues, but when they do arise, there has to be some sort of treatment. So for common injuries like a pulled hamstring, a rolled ankle, RICE is the #1 treatment. So RICE means rest, ice, compression, and elevation. This will help with blood flow to the area. This will help healing the area, and hopefully get you back to where you can do the things that you like to do during the day. it's not always super helpful. It can't always fix every problem because a torn ligament or a torn muscle probably is going to require some sort of surgery, but this is going to be the first thing that people tell you whenever you have a common injury. Things for cuts and scrapes, Band-Aids, the normal stuff, that's not really something that you can control. And then things like a broken bone. Well, the only way to really prevent a broken bone is to make your bone stronger. But a lot of these broken bones are just freak accidents, and there's really not too much that you can do for that. And like I said, pull muscle is very similar. Just use rice, trying to keep your body healthier even after an injury. Okay. So now I want to talk about chronic pain. Chronic pain is something that a lot of people in America suffer with. And it is due to what you asked earlier about sedentary lifestyle. So one of the most common things for younger generation is neck and back pain. And whenever I say neck and back pain, I mean upper back. So something that a lot of people nowadays have is a cell phone. Everyone you know has a cell phone almost. So we spend a lot of time with our heads down on our phones, looking down like this. Maybe we even have the phone really close to our head, so our shoulders are coming up and our neck is really scrunched over. That causes a lot of issues in your back. And a lot of people don't realize that. So there are some ways to prevent this that we'll talk about in just a minute. But a lot of these issues, neck pain, lower back pain, foot pain, arthritis, carpal tunnel, and other nerve pains, are generally due to a sedentary lifestyle. Whether it be sitting or laying down or, just kind of staying in the same spot. I mean, it can be a lot of different things. So for treatment for a lot of these injuries or chronic pains, opioids, muscle relaxers. I personally actually work in a pharmacy, so I see people who come in for these medications all the time. And it's pretty sad actually, because in America there is a huge crisis with opioids, and a lot of these can be prevented for the most part just by keeping up with your health. As I said here, painkillers, what else did I say? Nerve pain medications, and physical therapy is a good option for a lot of these issues as well. But a lot of people don't like to spend time doing physical therapy because they think that they have other things that are better to do. So now we're going to move on to something a lot more serious, which is life-threatening conditions. So the first one I list up there is type 2 diabetes. That is also something that is connected to nutrition and exercise. While it can be partially hereditary, a lot of this just has to do with how you eat and your body composition. So having a really high fat percentage can increase your insulin resistance, and that can lead to type 2 diabetes. So your body's insulin ratio to sugar is not very great, causing type 2 diabetes. And then obviously some other things, heart attack or heart disease, organ failures, and something that a lot of people don't actually think about is like elderly people when they fall. Generally, if an elderly person falls and breaks their hip, they have like 5 to 10 years or something like that left on their life is what they consider as like normal, which is not a long time. So if you fall and break your hip as an elderly person, that's really scary. And then the last one that I have here listed that I didn't talk about yet is car crashes. Accidents are one of the biggest issues when it comes to death and life-threatening conditions because they're just not something that you can prevent, really. I mean, this is one of the few exceptions. There are ways to lessen the chance, but it's an accident. There's a reason it's called a car accident. So we'll get into that in a little bit as well. So for treatment, as I say here, sometimes there's not really treatment. Other than like people who are on dialysis because they have kidney issues, or people who have like they get a stent or like a bypass surgery put into their heart because they have like bad cholesterol or blood pressure or whatever issues, and they have blockage in their arteries. Those are the only things that can really be treated per se. Obviously, you can treat somebody who's been in a car crash. You can stabilize their neck. You can give them surgery. You can give them these things, but the treatment for that is so expensive, and it's just, you know, you get into an accident. There's not really much that you can do about it. You just kind of have to do whatever you can to survive. And for things like dialysis and heart surgery, it's kind of something that you want to try and prevent before you have to actually do it. So next, we're going to talk about what's up.
I'm sorry, I have a quick one. Okay, so you talked about type 2 diabetes.
Yeah.
That's the one, they do insulin for themselves, right?
Right.
Like every time they eat.
It's not every time they eat. It just kind of depends on
Their
how.
sugar, right?
Right. So the insulin kind of breaks down the sugar.
Okay.
So if they have too high, well, okay, there's two different types. There's like hyperglycemic and hypoglycemic. Hypoglycemic means that like they don't have enough sugar. Hyperglycemic means they have too much sugar. So it can really just depend on like their specific situation.
Mm-hmm.
But a lot of people who have type 2 diabetes do have to insert insulin or like really watch their blood sugar levels,
Mm-hmm.
if that makes sense.
I was only asking because my mom has diabetes, but
Yeah.
hers was like steroid induced.
Uh-huh.
So now that she's not taking the steroids, like her sugar levels are
Normal.
leveling back out.
Yeah. And that's something like type 2 diabetes, I'm saying, is something that's like can be
Mm-hmm.
like fixed. Now, obviously, not every situation is the same. Some people are going to get type 2 diabetes whether they're healthy or not.
Mm-hmm.
But it is less likely to be like hereditary than type 1 diabetes, if that
Yeah.
makes sense. Like
Okay.
type 1 diabetes is considered the hereditary type of diabetes. if
Now,
that makes sense.
okay, but what do they do for type 1 diabetes? That's not life-threatening, is it?
It can be. That's a good question. Let me think. So for type 1 diabetes, it's not really something that you can prevent.
Mm-hmm.
Like it's something that you have to treat the entire life, because that's something that you're going to be diagnosed with like pretty early,
Okay.
more than likely.
Mhm.
But I mean, it just kind of depends on the insulin issue. So like,
Okay.
it kind of just depends. I mean, there's specific things that I could get into, but like
Yeah.
for like the broad spectrum, it's type 1 diabetes is not exactly preventable. Type 2 diabetes is, if that makes sense.
Yeah.
Okay. And then we're going to move on to prevention. So, common injuries. Again, cuts, scrapes, broken bones, things like that. Most scrapes and cuts can't really be prevented. Like, good luck trying to prevent a cut. Like, it's just not going to happen. Your skin doesn't automatically get thicker. It doesn't happen. You're going to get cuts, you're going to get scrapes, you're going to get bruises. That's just life. But for things like pulled muscles and broken bones, you can actually do something. So everybody's body has bones, muscles, tendons, and ligaments. And those are the four things that kind of make movement possible. So I wrote here Davis's law and Wolff's law. Basically, both of those just talk about how the muscles, ligaments, and bones adapt. So for Wolff's law, it's bone specific, where you put stresses on your bones and they adapt to the stresses that you put on them, right? So you do weightlifting, you do things like that, your bones are going to get stronger, they're going to get denser, right? So having these denser bones can actually lead to less likely like breaking a bone. So if you have really dense and strong bones, it is very unlikely that you break a bone doing something that maybe somebody who has less strong bones would do. So whether that just be like a fall or, just like maybe walking and hitting something really hard or whatever. So that's something that happens a lot with elderly people. Their bones start to break down because they're getting older, and their bones become less strong, so they become more frail. Something else that happens is sedentary people. people who do not use their bones for weight-bearing activities are going to have weaker bones. So whether it's just walking or running or exercising, it doesn't matter. If you lay in bed all day, your bones are going to be weak, making damage to them a lot easier. Same thing goes with muscles. Whether it be a pulled muscle, a tight ligament, tight tendon, whatever. Same stuff. Okay. And then I'm going to go over some, actually no, I'll just go back and do it now. So some of the things that you can do for these are weight-bearing exercises or resistance exercises. So for your leg muscles, obviously doing leg exercises is going to be easiest, but there's also little things that you can do like rehab. So for me personally, I've torn and hurt and injured and pulled and, you know, rolled my ankle a million times. I've done everything. And a lot of this stuff I didn't really understand while that was going on. So something that I do now is I do a lot of resistance training. So in this bag, I have a resistance band. It's not very exciting. It's just, you know, a rubber band. And basically, you can use these to do rehab. So what I'll do is, maybe I'll tie it in a circle here. And I can do things. So for my ankle, let's say I take off my shoe here. Your ankle can move in like, what, 4 different directions. It can go down like this, it can go up like this, it can go outside, and it can go inside, right? So you can use these to strengthen the ligaments and tendons and the muscles in any parts of your body. So something that's easy, you can I'll just lay down or sit down here and kind of show something for an ankle. I don't know if the camera can see me, but that's fine. So you can sit here like this, and you can flex your foot, or this is called plantar flexion. You can plant your foot, and this is helping these muscles along the front of your lower leg and helping the top and bottoms of your feet. And then if you want to do it to the outside, it can do similar things like this, where it's helping these muscles that are stretching and contracting. Same thing here. And then obviously if I did it the other way, it'd be the same thing. So using these resistance bands is a very easy way to do resistance exercises without having to spend too much money on weights. And using these, you can do an exercise in like 2 or 3 minutes. So there are some other things that I also do that you can just do laying in bed. Like for me, I have bad ankles and feet, so I'll do something that I call like a foot glove. I'll just put my hands, my fingers in between my toes and spread out my toes. That way I can work on the muscles in my feet, trying to strengthen them back up so I don't have a fallen arch. So we're gonna move on. Basically, for prevention of this, again, you wanna work out. You wanna put stress on the body to the point where it won't injure. That way it gets stronger and it can tolerate more stress to the point where if you were laying in bed all day, your stress would be a very low level, and if you're exercising, your stress level could be up here before an injury happens. Okay, I'm gonna put my shoes back on. Okay. So for chronic pain, like I said earlier, mostly due to sedentary lifestyle. Most people who work a 9 to 5, they sit in an office chair all day, don't move. And then whenever they get home, they're like, I'm tired, I want to lay in bed. I'm tired, I want to sit on the couch. I want to watch Netflix. I want to eat. I want to do this. I want to do that. A lot of the pain comes from that. So sitting all day is what's causing this pain. So one of the biggest things that the sedentary lifestyle has brought on our species as humans, posture and muscle imbalances. So having good muscular balance is important because it kind of it'll throw the body out of whack if you don't have good muscular balance, right? So for me, I had a shoulder injury and I've had a hip injury. They caused a lot of issues in my legs and in my arms and in my chest. So I've had to deal with a lot of muscle imbalances. Generally, whenever you're doing training, you want to be training both sides equally. That way, there is no imbalance, so there's no chronic pain. So for me, I had an injury in my left shoulder. Well, I still wanted to train, but I couldn't train my left shoulder the way that I wanted to, like I would have done with my right shoulder. So what I did was I took these resistance bands like this that I showed you earlier, and I did a lot of rehab. That way I could strengthen this one without moving this one too far, like ahead of it. So it'd still be more imbalanced. That way there wasn't an increasing amount of stress on one part that could cause another injury on another part. So in my legs, whenever I was in high school, I didn't have any of this knowledge and I didn't understand how this worked. So I had an injury in my hip that went untreated because I didn't have the money and I didn't have the personnel to teach me how it works. And by my hip going untreated, it caused trickle-down injuries. So a weak hip caused my hamstrings to overfire, which means that they're working too hard. So I had very strong glutes, very strong hamstrings, very strong quads, but I had a weak hip. So every other muscle that's attached there to your hip is going to take over if you have a weak muscle. So I was very quad dominant. I did a lot of jumping, and that basically caused my hips to tilt forward, meaning that these hamstrings were always overly stretched. And one day I was running, and that stretch just decided that it was gonna not stretch anymore, and it was just gonna pull. That's what it did. So I tore part of my hamstring just because I wasn't strengthening up this hip to stabilize the muscles in this area and stabilize the tendons in the area. So initially my hips were like this, then I hurt my hip and it started moving like this, and then this caused my hamstring, which is this muscle here that attaches here, to stretch and stretch and stretch, and then pull. And then it just kind of went like that and tore. And I could have prevented that. I could have healed my hip up and really worked on the balance in my body and in my lower half. That way it didn't tear my hamstring. I could have had the one injury, fixed the one injury, and not had the injury happen over and over again in my hamstrings, if that makes sense. And now we're going to talk about life-threatening conditions. For life-threatening conditions, there's not too much prevention that you can do. There are some of them very specifically, like heart issues or artery issues or kidney issues, that you can prevent by exercise and nutrition. Just by eating healthy, you can really help your digestive system not get to a point where things start shutting down. But car crashes were one of the things that I talked about earlier that are accidents. You can't exactly prevent an accident from happening. It's an accident. That's why it's called an accident. But there are actually things that cause these accidents. It's not just random events that happen. For kids, it's mostly texting or not paying attention. But something that's actually very interesting is a lot of elderly people who get into car crashes is not because they weren't paying attention or not because they can't see. That would be one that a lot of people think. But it's actually because they don't have the mobility in their neck to be able to turn their neck and see through the window. So if I'm at an intersection like this, and I'm an old person, and I can't see behind me, how am I going to see the cars coming this way if I can't turn my head a full 90 degrees? So, by keeping the flexibility and strength in your neck and your back, you really actually can prevent some car crashes. That's not something that a lot of people really think about, though. So that's just one of the things that that you can use to prevent one of the most accidental life-threatening conditions, I guess, if that makes sense. And then I believe that's the end of the presentation. But I do have a couple of closing words that I wanted to say and if you have any more questions, you can let me know. Overall, one of my biggest takeaways, if you learn nothing but this, just remember that there are small things that you can do every day to prevent big things from happening later on. Whether it's a little bit of cardio, or maybe some strength training to keep your muscles from being imbalanced, or allow for your muscles to strengthen and be able to resist higher loads. That way you're not in pain all the time, or you have a less likelihood to injure a bone or muscle. And also keep your diet in check. If you keep your diet in check, you can prevent a lot of random issues in your body. It can keep your body fat percentage down. It can keep you from getting diabetes, and it can help you continue to live well beyond what someone who doesn't exercise or has good nutrition will live. So I hope that you enjoyed that. I know it's kind of long, but hope that you enjoyed it. Do you have any questions? No? Okay. Well, I guess class dismissed.